So, hello everyone. I'm very happy to welcome you today, together with the shared patient experience team, to today's SPX Tech Talk. For those who don't know me yet, I am Daniel Ritter, a member of the executive team of SPX, Shared Patient Experience, and also president of a French company called Better World, which is leader in the usage of AI to improve the patient experience. For those who are joining us for the first time, let me remind you two things. First, SPX is the European Patient Experience Organization sharing best practices across facilities and healthcare organizations at the scale of Europe. And secondly, SPX talks are organized on a weekly basis over lunchtime to take the least time of your crowded days in order to share innovations among healthcare professionals about patient experience. So let's go for it. Today, we will discuss about the link between music and patient experience. We all feel the impact of music on ourselves in key moments of our lives, but guess what? It has also a significant impact on patients during their patient journeys. And to discuss this topic, we have invited two amazing professionals on the topic. So let me introduce you to Dr. Gilles Boccara, who is anesthesiologist and intensive care medicine doctor at the American Hospital of Paris. And let me also introduce Pierre Le Corre, who is the CEO of Music Care. So Pierre and Gilles will share their perspectives on the topic for about 20 minutes, which will leave us time at the end to answer all your questions. Pierre and Gilles, I hand it over to you.
Thanks very much.
Thank you, Daniel. What we will do, Gilles, is that I will introduce first Music Care. We will play the video, and then you will be able to go more into details in the American Hospital. Okay for you? So welcome everybody, and happy to meet you. My name is Pierre Le Corre. I'm the CEO of Music Care, a French-based company. And I'd like to precise that before being working with Music Care, I was a patient myself. So I tried Music Care while being treated for chemotherapy 4 years ago, and that's how I came to work for Music Care 2 years later. Just a bit of history. Next slide, please. Music Care is a 15-year-old company that was created by Stéphane Guettin, who is still the chairman of the company. He's himself a musicotherapist and a doctor in the psychology clinic. And he founded Music Care to provide music therapeutics to the hospital and also to prove through the research that music was providing proper significant results regarding pain, anxiety, and sleep disorders. So since 2021, we are a class 1 medical device. We have already accumulated in the past 20 years 17 randomized controlled studies, and currently we are working with over 500 medical establishments, both hospitals and aged patient residents, mostly in France as of today. What is very important is that we are clinically validated, and this has been the work of Stéphane over the years, and Dr. Boccara also participated in many of these studies. Next slide, please. The next slide, please. I don't know if it's changing. Yeah, here you are. So we are a non-pharmacological intervention. What is important is the music. You can hear Music Care, the cure is made for Music Care. I will come to it afterwards. And it's not something that you can find anywhere else. We have no side effects. And we are a market leader in terms of this solution, music as a therapy. Next slide. Just a few seconds. I know Gilles will speak also about it, but how it is working, what is the active principle? is that actually we are reproducing through music the principles of hypnoanalgesia. So by working on the tempo, on the music, on the orchestra, on the frequencies, we will reproduce the U shape, the U sequence that is the basis of hypnosis to provoke a state of a modified conscience. So we are using it mostly in these two protocols. Even if we have three protocols, we also have a third protocol to wake up. Gilles will probably talk about that later on. But the music is composed under constraints by real composers. So we talk a lot about artificial intelligence. Music here is definitely a mix of human and artificial intelligence. Human intelligence first to create this music. So we have got real composers. It's recorded in studios. You will see after that in the small video. And then we work. We've got a patent, and according to the level of pain or anxiety you or the patient will fill in, the music will start at a different tempo. This is a tempo modulator that to take the patient where he is and bring him down into his and modify his vital parameters by listening to music. And next slide, please. I'm trying to be fast because I know we are in a short period of time. Just a few illustrations of the results. Of course, we can provide all the studies that are backing that. Gilles will comment some of them, but just some illustrations of the results that we have accumulated over the years through controlled studies or more pilot studies. But the fact that music actually is definitely not nice to have, it's a must-have because it has a real impact on pain and anxiety and on drug consumption. So here it is for me. I think I am in the 4 minutes time slot, and maybe we can go for the video, and then Gilles will go more into detail and present how it is using in the American hospital in Paris.
Today, the use of music for therapeutic purposes can be applied to a very varied number of pathologies, particularly in pediatrics, neurology, geriatrics, and above all, mainly in the treatment of acute and chronic pain. We currently use music care for interventions of interventional radiology, for actions which are usually done under local anesthetics and sedation, even if only optimizing sedation using music care. We can see that there is a gradual reduction, a gradual sedation which is parallel to the rhythm of the music. We use it and offer it to the patient, like self-hypnosis. When he explained the procedures to me, he spoke to me. He told me, it will be like a kind of hypnosis. I told him, I don't think I am the right client for that. I don't believe in it for a second. That's why I was very surprised, because overall, I wasn't aware of anything. So, the protocol that we have developed is based on the principles of different relaxation techniques, except that we will replace verbal suggestions by musical induction. Today, this protocol is based on a technique known as the U sequence. This U-shaped assembly is made up of 3 phases. A first stimulating phase which represents the patient's state of tension, his state of vigilance, and the goal through music is to modify the state of consciousness and bring the patient to a state of relaxation by variations in rhythm, melody, harmony, and frequencies.
We have seen children taking medicine which isn't as strong. And post-operation, music care can also be very interesting for patients who struggle to get comfort from all the other techniques. When music is used, there's a real correlation, whether this is for anxiety, pain, or vital parameters.
We can hand over to Gilles. Dr. Boccara, your mic, yeah.
Yes, thanks very much. Thanks, Daniel, for the invitations, and Pierre. And I'm very happy to present you our experience, clinical experience of this technique. And for us, I'm anesthesiologist and intensivist. I use every day very strong and very effective drugs to reach the general anesthesia or the sedations during our cares. But we use every day some techniques to help the patient to be more comfortable, more relaxed, and to get relaxations. And this technique, very easy use and simple techniques of music care. It's a music therapy with web applications to help us to take care about all the patients. And I would like to exchange with you and to share our clinical experience. The next slide, please. And like you saw in the video, and the material we use is a tablet, smartphone. In the right side, this is for coronary angiography. In the left side is for orthopedic surgery and local regional anesthesia. But every day we can use a U program or a L program if you would like to have more sedation or relaxations. Next slide, please. And we have a lot of publications now in the world about the technique. And the music therapy is very common to use it during the intraoperative period, but also in postoperative, in PSCU, and in the surgical world. And you can see the music therapy has already proved effectiveness in reducing both pain, intensity, and anxiety levels during orthopedic surgery, for example. But we can find the same result doing a lot of various interventional situations like cataracts, coronary angioplasty, ventilatory weaning from mechanical ventilations, and from 15 years. And Stéphane Guettin and his staff, medical staff, and INSERV of Montpellier start a lot of clinical studies. And now we have some publication to explain that. And the question was also to compare the music care, this program, with the music list. Sometimes a playlist could be effective also and enough. But you have now a lot of publication also to demonstrate that it's better with the U program, because it's a very hypnosis applications compared to the command and the choice of the music by the patients. Next slide, please. So why we use it? Firstly, why? Because one day my colleagues, specialists of the pain, the chronic pain, asked to me for the hospital pain committee in 2016 if we could use this new web application of music therapy. He said to Stéphane Guettin to come in Paris from Montpellier, and he present this technique to our committee in American Hospital. He found immediately a very important enthusiasm from caregivers and from the physician. So, to be sure it's a very interesting technique, we use it, we try this technique in coronary angiography under PMA, procreation medical assistance. It was the first time. When we find a very interest for the patients, we start the training of the nursing staff, firstly 24 designated nurses, and then we deployed the technique, the music care program, in different places in the hospital, PSCU, coronary angiography, surgical room, procreation medical assistance, MRI, and chemotherapy and oncology. Of course, we have to evaluate this technique, and to be sure there is a validation of all my colleagues and nurses and all the healthcare workers from the hospital. As firstly, we start with 8 first tablets. It was not a lot, but with that, we reach a validation of the technique. And in 2018, we continue with 8 more tablets, further tablets. And now we have in all the places and all the sites in the hospital. Next slide, please. For example, for the evaluation, we did a clinical prospective study to find if there is a real interest in the sedation during coronary angioplasty or angiography. And we have a very interesting result because we found a reduction of the sedative of 2/3 less sedatives during the procedure, just only with the music care. And you can see in the video, you can see a patient during the procedure. He said that he didn't trust in the technique firstly, but after he was very surprised by the real result and the relaxation during the procedure. Next slide, please. And so, why we would like to diffuse this technique in the hospital for all the patients? Why? Because firstly, it's free. We would like to use it without any restriction. It's not like the medications. It's not like very important techniques. It's very easy to use. You have the tablet, you have the music. You can ask to the patient if you would like to have this music therapy support, and the patient could say, okay, I would like, I need it. And in this case, the nurses, without prescription, could use it. And it's very interesting for all the caregivers for the hospital, and their discretions, without to ask the physicians, for the patient, but also for themselves. We have a lot of nurses, they use it for them to avoid, and there is some publication now to prevent the burnout, and we could use it also for the stress of our caregivers. And the most frequent situations is preoperative period while waiting for the intervention or operations. Second, postoperative in PSCU, in maternity wards, following before the C-section, for example, doing uncomfortable or painful care in the wards. It could be, the music care could be combined with the virtual reality. We have a program also with the virtual reality. It's more important device, but we can use it with the images on other relaxing techniques. Now, in American Hospital, we can integrate, we can include the music care in the new integrative medicine project of our hospital. We have to do a new building for that, and a new floor specifically for the integrative medicine, and the music care is one part of this project. For example, in the right side, you have the different reasons. That is Mrs. Smitek is my nurse responsible in oncology. She did a study, clinical study, very easy with all the reasons to use music care, for example, for in oncology and chemotherapy. And you can see it's for anxiety management, pain management, for the relaxing and time management during the chemotherapy infusions, help people to be asleep, or against the nausea and vomiting following chemotherapy, and only for the curiosity. Sometimes the patient would like just to try it. And this is the main reasons the nurses use it, for example, in oncology, in our clinical experience. Next slide, please. So, with our regular and preparative use of the music care, just this morning, for example, we did a lot of orthopedic surgery for example, for the upper line, and under local regional anesthesia, and it's very interesting to use it. But we would like to be sure is the music here, it's like in the publications, better than a playlist, your choice of music, Johnny Hallyday, U2, what you would like. Or it is this special program with the applications of the U technique, the reduction of the tempo, of the number of tools from the orchestra. And we did, now we did randomized the clinical study, but I can't give you for this time all the results, but it's a very good and very interesting results. And we have a new technique to monitor the pain intensity during the surgery with the NOL. NOL is the nociceptive level device, and to be sure the music care has an effect to the reduction of the painful. Next slide, please. So to conclude, of course, the music therapy and especially the music care program could promote well-being for all our patients, but I think for all the patients. Firstly, because it offers innovative pain management to significantly diminish the perception of pain. Secondly, to propose an effective therapy with no side effect and reduce the use of pharmacotherapy. I reported in the video the reduction of 2/3 of sedative, midazolam, benzodiazepine. Third, to improve the daily life of the patient suffering from pain, but also to fight against this anxiety of depression. And lastly, facilitate care demonstration for the caregivers, because it's very, very easy technique. It's just a tablet. It's like every day. It's not a social wizard, but since you have the music in your tablet or in your smartphone, it's very easy to use. In our clinical experience in American hospital, we have very high satisfaction of patients. In the different studies, we had 95% of patients with 5 to 5, 5 from 5. That's the maximum of satisfaction score. But also for the healthcare workers. This is very appreciated by the nurses, by the different colleagues, and it's very easy to use, but also very comfortable during the cares. And I would like to thank you for your attention, but it's about our clinical experience on that. Thanks very much.
Thank you very much, Gilles, and thank you very much, Pierre, for your interventions. You are fully on time. We have 5 minutes left for questions. And I see that we have first questions that have been asked through the chat. Maybe there is one, Pierre, you want to comment on, as you suggested, for the impact on all age classes.
Yes, there was a question about premature and nursing homes on the conversation from Val. I don't know who is Val, but from Val, from what I can see. Yes, indeed, actually, music care does not use any words. It's music only. Voices are only used as instruments. And this is really done on purpose. It's done on purpose so that we can address both very young children as well as people with advanced Alzheimer. And we do have very interesting studies that especially that we did with the French Red Cross during COVID, that is showing a very high level of satisfaction from the relations between the patient and the caregiver, especially in Alzheimer, by using music care. So actually, this is done on purpose. That it's true for very young and or older patients, but it's also true for patients that are not speaking French or English, because the application is available in both languages as of today. But music goes through the frontiers. So that's why we also have in our 60+ sessions, we have all styles of music. you've got electro, you've got a lot of African reggae music, you've got classical music, pop, etc., all built and composed on the same protocol.
So I can respond also to the questions. We have a lot of patients sometimes are very surprised, and they say, "Oh, the music is not enough to be relaxed. It's not enough to be hypnotized." And from my experience, I learned the hypnosis. I use hypnosis, okay, but the difference between hypnosis and music care is just to help to be relaxed to the very deep trances. We could use for all the patients. What in the hypnosis, we need to be at around the patient or to stay in during the procedure. For example, for us in the surgical room, we can be just need the head doing all the procedure with the X-rays with hypnosis. It's not possible also doing the MRI. And in this case, the music care is very interesting technique to help us for the question about music care and hypnosis. It's very different. But the more important is the target is to have a patient very relaxed. Sometimes the patient is relaxed, but he can respond to you. Sometimes it's very deep sedation. It's depending on the response. It's the same thing like for the hypnosis. It's the same thing. So we can use everywhere in the hospital. We can use just before the consultations when the patient is very stressed, is waiting for the gynecologist, for the anesthesiologist, because we are too late to have too much delay C-section before. The patient you have two techniques to relax the patient. To give him a coffee with a very good secretary, or to give him something to have some music. And by experience, in the consultation, sometimes the patient has his own smartphone with the ears, and to wait, the doctor is coming. But sometimes we can propose that. In the hospital, in American hospital, they propose in the consultations floor a special connection to have reading some book to read, and the patient could load this book and to read it. But we propose to our directions to have something to connect directly to the music care. It probably, you have the choice. Some patients prefer to have something to read. Some patients prefer to hear the music. It's very depending. But we have choice to the patients also.
Thank you, Gilles. And I see that the time we are running short of time. There is another question from Joanna. Daniel, if I may answer, from Joanna Hassan. They said, what is the financial incentive for hospital to adopt music? Yeah, Daniel first.
Yeah, let's take this one. It will be the last question of the session to hold the timing. So for the rest, I will conclude at the end and give you the contact details. Pierre,
okay. Yeah. So just to bounce on Gilles and to answer this question, to bounce on Gilles, we've got the University Hospital of La Réunion, who is using us in 42 out of 44 departments, which means there is still 2 departments missing, but out of 44, 42 are using music care because they can adapt their use to their need and their patients. And the financial incentive hospital, I'm not sure I understand Joanna's question, but the financial, incentive is that you will gain time, you will gain drug consumption. A patient, a department that is having 2 or 3 tablets of music care, it can take care of these patients because, as Gilles mentioned, while a patient is under music care, and without play of words, but under the care of a music session, is not asking or calling for the caregiver, so that the caregiver can dedicate his time to another patient or to do properly an intervention or an act. So that's how there is an incentive for the hospitals. I would say, and finish on that. Daniel, the floor is yours.
Thank you very much. So I take the floor again. Thank you deeply, both Gilles and Pierre, for your intervention today on behalf of the SPX team. Thanks also to all participants for your presence today. I hope that this gave you some ideas to further improve the experience of your patients today, thanks to music. And I want to remind you the next sessions of SPX Talks also, as you can see in the chat. There is one on December 4th with Alliance PEP Santé. This one will be in French. And on December 11, it will be a session in Spanish about how to give bad news with Dr. Gemma Claret-Teruel, who will share some insights about how she simulates actor play to prepare for the announcement of a bad news. So this will be on December 11th. Thank you again to all. I wish you a great ongoing day, and I hope that all your patients will benefit from these ideas coming from SPX Tech Talks. Thank you.
Sure.
Thank you very much, SPX team.